ended up working in healthcare. When I graduated from high school, I, I did the exams to go into the uni. And we call it Joint Admissions Matriculation Board exams. And I did it. The mark I scored is likened to the UCAS here. So the mark I scored I was given biology to study or zoology. And I felt if I study a single honor degree, I'm going to end up being a teacher, which I didn't want to because both of my parents were teachers. And I have two siblings that are already teachers. So I felt no. And actually, the next thing to think of is what is my passion? I like caring for people. So I decided to go for nursing instead. I trained in one of a university college hospital in my country, likened to the same university college hospital in London. And it's a very big institution which has the same settings like University College of London, your College Hospital London, the buildings, everything together. So I opted for that because I wanted a very quality education in nursing, which I really had because all the specialty, they've got it there. And actually, in my country, when they say in a smaller hospitals, they say they are referring you to University College Hospital, Ibadan. You get scared because you feel that your case is past a certain level and it has to be taken care of in University College Hospital. I was a very good student, very. I had a very good pass in my study in the School of Nursing, and I finished nursing. I went on straight to do a year qualification in midwifery, which I don't practice here. I trained in Nigeria and I came to UK in 2008. I came into UK 2008 to do my overseas nurses program. That's what it's called then. And I did that in the University of Sunderland. I had a placement, 4 weeks of study and placement for 6 months. I had my placements in the Midlands, West Midlands, and that was where I had my placements. But the the uh, uh, the program was really very interesting and fascinating, and that was 20 years after qualification in Nigeria. Initially, when I finished the classroom, the protected studies, as it's called, for the first 3 weeks, were meant to go on the placements, which I did. And I was placed in a nursing home in Walsall, in West Midlands. And I had that. I had one specific experience with healthcare support workers, which are carers in the nursing home. It was a big discrimination and sort of like abuse because I was, despite the fact I am a nurse, overseas nurses program nurse, they made me to do all the work while they go out to have a smoke, and sometimes they would have gone on their first break and stayed there watching patients and doing the personal care while they are on their normal break, the lunch break. And if I say anything, it's like, you've got to do your work. You've got to do your work. And that was how I had to let the manager know about this, which she addressed at that time. But a very good experience also was there because my mentor was a very, very, very nice person. And she recognized the fact that I had a quality education and I'm a very good nurse because she commented about that to me during the placement. There were challenges. One is with the accent, and when patients say to you, or even colleagues say, I can't understand what you're saying, I can't understand what they're saying, and you keep repeating yourself over and over again, try to say it in a different way, try to say it in a different way, and they still keep on. Sometimes, you end up knowing that they're just trying to play up or, discriminate because of your background. But it doesn't really get into me because most times I end up being the one that the patients points out that nurse, that African nurse is a very good nurse, is a very good nurse. She did this, she did that, and things like that. So it's always very encouraging when you hear that, but you get a few challenges with that, your accent, and also the understanding. I could remember one very good experience when I booked in for as a bank nurse in the NHS, and it was, the first day I had to go on shift. We'd use the analog thermometers to measure our temperatures, and it was a difficult thing to use the temperature probes. So applying the probe, the covers and everything, but I had a patient who was on, and it was on admission, but used to be, he's a support worker. And she said, no, this is how you do it. And she was the first patient I was supposed to do the observations for. And that helped me a lot. She's an African person, an African too. So, but as time goes on, I moved past most of the challenges. When I came for my training, I planned to stay, but I had strings calling me back to Nigeria because I came alone. I have a husband left behind in Nigeria and 3 children. So I couldn't, and the youngest then was like 3 years, 3 years, 4 years. So I couldn't stay back as I would like to just continue. But I tried to, join it together, bridge it, and go back to bring them back immediately. But unfortunately, it wasn't that easy. In 2010, after I've completed the Overseas Nurses Program, I've done a top-up degree in the same University of Sunderland. So I just decided to go bring my family at this time so that I can settle down. But unfortunately, I wasn't able to come back with them until 6 years after. All of my other colleagues that we did the top-up degrees together, and they are on student visas too, they they just did their post-study work visa while in England. But because I had a family I wanted to go back to, I couldn't do my visa at that time. So I decided to travel before I do and do my visa, then come back with them, extend my visa with a post-study work visa. So I took all the normal paperwork from the uni to do my own visa to my country. But I got there and the visa was denied, and I was just given two weeks extension. By the time I received the visa back, it was remaining just a week of extension that I was coming to the UK to study for just 2 weeks. And we started explaining. I went to the embassy to explain that no, I was already on the course and I was just looking for an extension to return back to the UK and do that, because I already put money in the account to do my post-study work visa. But it didn't work until my period of study expired in September. And that made me to go on, apply for the post-study work visa there in my country. But that was denied also because they didn't accept the money I put in the account in the UK. They wanted me to put another money in the account for 3 months in Nigeria. So along the line, my younger sister, who was looking after my children while I was away for the 2 years, took ill, and she passed on. So I had to stay back because she had a 2-year-old too to look after. My youngest was like 5-7 years then. So I just closed my eyes and I stayed back. Then I went on to get employed with a diabetes specialist hospital in Nigeria. I first worked with them for like 2 years. Then I moved on to the Lagos State University Teaching Hospital until I had the opportunity when they said nursing became a shortage occupation in the UK. So I applied to the NHS from from Nigeria, had my interview on Skype, and I was employed directly to where the NHS I work with now. And that was, I came back in 2016, 6 years after. My immigration status impacts me a lot. And it's a work visa, and on the work visa is written clearly on my residence card that's restricted work. So now what that means is that after your contracted hours with your sponsor, you can't work more than 20 hours. And that is so strict that even when you want to do extra work, you have to be looking at the hours you would do, which is not giving me enough income to support my family. And for me, I also have a specific case where my partner took ill immediately I came into the UK, and he had a very challenging health. He was admitted over and over again and things like that until he was able to have a transplant. And so it was very, very hard to leave a family of 5 to live on my income on a visa, and we had no recourse to public funds. So with 3 children, a partner who is sick and myself, it really impacted us. But during COVID, we got past the restriction because of COVID. We were allowed to work any number of hours that we should be able to. But before then, it was really challenging, and we are still on no recourse to public fund. The visa costs a lot. It costs a lot to renew or to extend the visas, because we were first given 3 years and came into the UK to extend for another 2 years. We finished the 5 years now, but we are not able to apply for indefinite leave to remain yet because of the cost, which is very, very high, 2,400 per person. We had to pay all those 5 years. I had to pay immigration health surcharge to use the NHS for the family. So in 2019, when we were extending, that was increased. It was doubled. We used to pay 200 per year per person. It was doubled to 400 per year per person. So for the last 2 years extension, it was £800 each per person. And for 5 people, that's a lot, plus the visa fees and everything. So it's really been very, very challenging for me as an international nurse. Not being able to access benefits from the NHS or from the country as an overseas nurse who's coming to work for the NHS, to care for people as if they are our own, and you do everything, you put in even extra time, overtime, and unpaid overtime and things like that, for one not to be able to enjoy the benefit is really, really painful. Even when I was having challenges about private renting and things like that, we're having challenges over food. You can't go to the council and say, please, can I take a council flat, which will be a bit more better for you and cheaper for you to take. But no. And so many times I went up the brick wall. I cry and everything, not being able to sometimes meet up with feeding. It was as bad as that, because when it was only me working, there's nothing else to add to it. When I do agency shifts, and once I'm going like 16 hours or 18 hours, they'll begin to alert me, you can't do more than 20 hours. And even to get a loan, it's difficult when you're on a visa. I later realized that was the reasons why they were turning me off. It was really, really very tough on us and the family, or me and the family. It was. And sometimes I've written to MPs, I've tried to appeal, especially for this indefinite leave to remain. That's at least we paid our own quota as overseas nurses, with the visas, immigration surcharge, and things like that. And we've done that for 5 years for us and our family. Then why not, especially after this COVID, give us free indefinite leave to remain? And let things be a bit easier. Then the no recourse for to public funds, that is absolutely not good at all. It's not good at all for anyone, because even when you are on a low income, or your partner is not able to work, you have no recourse to public fund. But you work for the government, we work for the government, you do everything that is necessary. I feel about the government that they are not really being realistic, and they don't actually value us nurses as much as what we do. And we take on everybody's work. We take up the physician's work, we take up the healthcare support work, the social workers' work, everything we do together as nurses. Because a lot, a lot, a lot of work, a load of work is on nurses. But for the government to recognize that and, value the nurses as they are meant to be, little rewards help a lot, and it protects your mental health sometimes, and it protects your health, your state, your the way you visualize things. If when people go all out to take care of the community, take care of the country, during this pandemic, nurses don't care about their lives. You shouldn't be rewarding them with only claps. What does that do? Clapping for them for risking their lives. You clap for people when they risk their lives, when to save other people, to save the community, to save the country. You keep clapping for them. It doesn't match together. You need to give them more things that are more rewarding. Look at every hands of the nursing, the local, the citizens, that are nurses, in whichever way, whether they pay or whatever, know how to reward them with that. And the overseas nurses, people you've gone to their countries to recruit, you flew them over miles to bring them into your domain to work for you. You should be able to reward them. You should be able to give them some things freely, not having to put them under strict rules and conditions to work. A work visa, especially for healthcare staffs, should be removed, because there's so much restrictions, there's so much rules, and I don't think, especially for healthcare workers, I don't think it should be in the play for us. Other countries, I don't think that's the way it is. At least I know about Canada. It's not like that. They value the healthcare workers and their residency. It just takes 3 years to be on the residency visa, and you become your citizen after that. But here it has to be 5 years, and you pay a lot. For the 6 years, to the 2 years I did extension, it cost us almost 8,000 grand to renew just the visas. So the government really needs to look at a more rewarding things for nurses, not just clapping. I have experienced different kinds of racism in the workplace. uh, and it's it's different kinds, from, as I said, from your accents to your the the way you work, and people feeling you don't know anything because of your color. I will explain that further as an example. In a workplace you work in, and you are assigned to a set of patients which you have to be in charge. You have support workers working with you, and you have a patient you're dealing with all your their routines, daily routines, and doing your dressings, your medication, and all things like that. And you have a patient that is poorly, whether in your bay, in your bay, but you are off to do other things, and before you could come out of what you were doing, you see a senior nurse or even the same band level and coming in to your bay, going to see that patient that is poorly because the healthcare support worker working with you has run to them to come and check on this patient while they left you in the bay, not saying anything to you because they believe that you don't know what to do. You don't know anything. It's not that they actually voice it out, but that is what the action means. And I better go call the other nurse in the other base to come and look at this patient because this one, I don't think she knows what she's doing. You raise it up with a manager, and the manager says, are you sure you are not imagining it? And things like that, And you are like, no, I am not. I know what it means. Why would they leave me? I'm in charge of this area. Why would they leave me, not informing me this patient is poorly and going to call another person? And whatever you say does not hold anything. They just come back to you like, no, don't worry. It's nothing serious. It's because the healthcare support workers worked here for a long time, and they know the patients more and things. They feel free with the other nurse because she's not of color like me. So, and you can't win anyway. So we just admit is that, well, you just go on with your work and making progressions. I'll come to that. It's really, really tough. But in my own case, not every nurse or of color we do the same that I do, but I just believe that whatever I do, it's for me and it's for my benefits later on. So I don't let it stop me because you can't get through progression with them. It's very, very difficult. So every training, every courses I have done, is it I pay my way through? Pick it, if it's a free course, I just go for it. So many of them I have to use my annual leave to go for it. I have to, pay for it myself. Conferences, attend conferences and things like that. I just pay my way through. Even doing a master's degree, I'm paying for it. I pay every bit of my fees myself, not so. I wasn't depending on them. Because when you come and say, I've seen this course I want to do as a continuous professional development, as a diabetes link nurse, this diabetes conference I would like to attend is a 3 days workshop or conference, and it's going to cost this to help me to work better in this environment. They say, no, you can't. You can't. The only thing I will advise you is if you can pay for it yourself, and you pay for it yourself, you take your annual leave, you go for it. Well, it's my certificate. It's adding to me. It's not taking away from me, and I just take it that way. But moving on, when you are on a level, band 5, band 6, you are on a band 5, and to move to a band 6, you've seen the role. I qualify for this role. I can do this. I can do this. I meet all the person's specification. Then you go for it. You do the application. They look at the application, and it's like, yeah, we need to add some minority ethnic group in these interviews. So they select, you are selected for the interview, and they send you the offer of the interview. You have to read 5 times better than all the other people because you want to get past the interview. And you go for the interview, you yourself, you know that you have done excellently well. They don't have anything to say that, no, you have not done well. And they give you a feedback and tell you, oh, somebody did a little bit better than you at the interview. And so we've offered that if we had funding for 2 people, we would have taken you next. And I say that with my other colleagues that are Africans, Asian, and they look, is it the same thing they say to you all too? And some of them will say, I've heard it like 100 times at interviews. And that's what you keep having each interview, unsuccessful, unsuccessful, unsuccessful. And you find out that you have somebody who's just qualified 3 years ago, 2 years ago, and they had applied for the same level, band 6, they take them instead of you. And the person, even if you are in the same unit, you just want to move from that 5 to 6, they'll take somebody else from outside because you have color. And the person comes in, a band 6, you are band 5, and you are the one that's, oh, I've not had my training in the bloods. Can you do the bloods for me? And I wonder, okay, why were you employed then? Because you are meant to be taking things that I can't do because you are a band higher than I am. So you end up being the one helping them to do the work of the band 6. And you are still in the band 5, you were refused for that band 6. And you wonder why. Why everybody should be treated the same way. You've had experience and you've been qualified 30 years, 35 years, and we remain at the top of a band for years, 15, 20 years. So many of my colleagues do, but not progressing because they won't just allow it. Recently, I'm a band 6 with the place I'm working with now. And that happened because I just stepped forward. Because everybody I work with, and we do this exactly the same thing, is a band 6 there. So I had to approach them and said, no, I'm a band 5, just one of me in the midst of all the band 6, and we do the same thing, exactly the same thing every day. And we've been doing that for a couple of months. So what happens? I need to be moved to a band 6 too. And that was when they had meetings and decided to give me the chance to apply for a band 6 there. And I got it. I think the barrier is because of my race. It's just, it's a way of discrimination because of race. I think there's discrimination between the three sets of people that we have. We have the Asian, the Caribbean, and the Africans in the ethnic minority ethnic groups that mostly, I would say that the Africans are the least favored when it comes to things in workplace. The Asians are still more favored. They have their own pattern of discrimination from another angle. But if, for instance, we have Asian Caribbean and African, the Asian is still got a more chance, and the best chance, I would say. Then the Caribbean have the next, then the African is the least. So it's there. And in between us two, the three ethnic groups, I think there's still discrimination between the three groups too, sometimes. I observed also that if you have an Asian in the midst of a panel of interview and they were going to disqualify, if even when the two people are on the same level, and one is an African and one is white, and they're going to disqualify based on the number of the panelists on the interview, and there's an Asian person there, the Asian will not support the African. They would rather go with the white person. So I've experienced that a few times. So I know that it happens. I first heard about COVID in February last year, and it was in workplace. And being in the area where I work in the NHS, it was when the issue was raised that we need to be wearing face mask, we need some equipment to be working with. The way it was addressed was that in the setting where we are not in the hospital based, because it's more of community, that we don't need all those. We don't need all those. And it went on for quite some time until March, towards the end, and suddenly we had an active case on the unit, and that was it. And I reacted badly because, as I've said before, my husband has had a transplant, kidney transplant, and it was like, God, am I going to take COVID to my family? I was so scared to my bones. I was scared. I kept on working. I wiped down like 20 times, especially when I'm on nights, on days, anytime. I keep wiping, washing my hands, doing everything. And we were allowed to start using face mask and things like that. It got to a point when I heard the news of the first case in my unit, I was like, no, I just need to do something, and I need to do it fast before I take COVID back home. So I approached managers and started off with, what are we going to do about that? It was dismissed. It was just dismissed and said, we're all scared, and things like that. I said, no, you don't understand. Because there are a lot of things that qualifies him as an extremely vulnerable person. And apart from that, we started hearing the news about the minority group being more prone and likely to die from COVID, and I became more scared. And we started off what they weren't going to just have it. And in the midst of it, so I too had COVID symptoms, and I isolated. But I looked for redeployment, but that was too harassed too. It was difficult to have that. They won't have it. So, well, I had to insist. I started feeling very, very vulnerable with it. Initially, everyone was like, no, it's nothing to worry about. You can't just catch it easily like that. But when we started hearing the numbers going up for healthcare workers, and particularly the minority group, I became very, very, very scared, very vulnerable, and felt that this could mean a lot to myself, to my family. And because my husband was already shielding, and I made them to understand that if my husband is shielding, shouldn't I protect him and not work in a COVID environment face to face with people? Well, it was a tug of war. It was a tug of war. Risk assessment, I didn't get it initially. It took the efforts of union to get me that done, and I got that. And looking at the risk level for myself and my family, then we started the process of having to redeploy to a place where it's safe enough for me to continue working, not to go into shielding, but continue to work as much as I could to support during the pandemic. I had to take it to the union because the management was not agreeing to allow me to work in a place where I don't have to do direct patient contact in order to protect me and the family with shielding. But they won't just have it straight off like that. And because I was scared for my life, scared for my family's life, so I had to step up to the union so that this could be agreed to. It took a while. It took quite a while before it was agreed to. But at the end of the day, I was redeployed. And I did all to support staffs and everybody throughout the COVID period. I really felt very angry about me trying to, protect my family, protecting myself from what you have heard about the COVID and how so many minority people died from it. So when I first approached the manager, my line manager, and I took over on that night, and it was like, I've been thinking, and I'm really, really scared about the situation. I have somebody shielding in my family, and I'm really, really scared that I might take COVID back home with them. I want you to look at it. Let me work from home. I know it's very difficult as a nurse to work from home. Can you redeploy me to another area, maybe more of administrative work and, in a way to support? But it was like, no, there's nothing you can do. We don't have anything for you. I said, in the whole of the trust, it's a very big trust. Why don't you just look around, communicate, and I can do anything. I have skills for a lot of things which I can do, and it will not be direct contacts. But they won't just have it. They won't just have it. So, and as a union member, also a union rep, so I just had to speak to the union and say, please, this is what I am experiencing. I am so scared, and I've tried to approach my management, but they refused. I'm so angry, so scared and everything. So please, can you step in? So my case was taken up, opened, and they started off speaking with the management. And along the line, it got so stressful because it's like every day you talk to them. In the midst of it, I myself had symptoms of COVID, so I had to self-isolate for 14 days. Then it used to be 14 days. And after the 14 days, the stress has mounted up because you are like, I have COVID, though my swab test was negative, but I knew I had it. So I did the isolation period and I returned back. To return back, at the end of the 14 days, the stress has mounted. So my GP gave me time off just to keep down. And I came back to the management. I said, you need to look for where I need to be redeployed to. I don't mind in any parts of the trust. I can move to closer to the place to do my work and everything, but no, they are not going to. They want me back in my unit. But the union took over and put their feet down, said, you need to redeploy this person. The risk is too high. And you won't want to compromise something like a transplant or the life of your family because you just have to remain where you are. No, you won't want to do that. So it got to a level that the management said to me in one of the meetings that I'm afraid you might be dismissed. That I might be dismissed, that she's scared that I will be dismissed from my work. And I was wondering why. This is not a disciplinary meeting. I've done nothing wrong. I only want to protect myself and my family. Honestly, I need to say to you, you get yourself dismissed. Then I was really, really angry. And I told her, yeah, if I get myself dismissed, that is all right. So far, myself and my family are fine. Then you will let me know in the dismissal letter what I have done wrong in my profession that warrants me being dismissed. And then she said, no, I'm just afraid that you will get yourself dismissed. I said, yeah, you don't worry about that. Let me worry about the dismissal. But coming back to do face-to-face patients, I'm not working. For now, no. I'm ready to work in any other environment, but not in face-to-face working. No matter the PPE provided, because the level of the PPE provided is just that penny and your gloves and your face mask. I didn't pass the FFP3 testing. Twice I did it, I failed it. So there's no way I'll be working face-to-face with patients. There's a crash call. I won't have to do CPR, or I won't be able to put on a FFP3 mask and do my duty. And if any of that, if I do it without that, I'm going to have to face the risk of contacting COVID. But it took the management, my management, the HR and everything, the union, before I got to where I am now. Okay. But in the end, it was a long journey, but I got redeployed secondment and everything. But that's the level it gets to for us as a minority ethnic staff. Whereas for the white staffs, it's easy for them to say, yeah, I have a family that is shielding. And they allow them to shield with them. But with us, no, you keep coming to work. And we've been told that the second time I had symptoms of COVID, and my test came back negative the following day. In fact, every swabs I've ever done is come back negative. But I've done antibody tests twice, which is come back positive. So I knew I had COVID. But the swab, maybe the way it was taken, fine. And swab test came back the following day, still having the symptoms. And I'm asked, are you coming back to work this afternoon? And I say, no, I'm not well. I'm still having the symptoms. So, and said, no, then it is sickness absence then, and things like that. I said, whatever you want to take it to be, fine, but I won't be coming to work when I'm not well. So many times it just has to go to the extreme. You have to keep up with the union to help you and to support you most of the time. because a lot of things they do is just to shut you up. And I know that many of these things happened to other staffs. Maybe I'm able to do that because I'm a union rep and I know some policies, I know the trust policies, I know what this says and that says, and I stand up for myself. But not all the minority ethnic group people do that for themselves. No. I witnessed that many black staffs when were being denied of a lot of things, especially risk assessments. A lot of them are, some of them are asthmatic, very bad asthmas, but they still insist that they come to work. They they didn't even receive any shielding letter, and some of them are on steroids. They still required to come to work. Some of them don't even know they can do self risk assessments, which managers were supposed to insist that they do. They don't. Some of my union members who contacted me knows that I'm a rep, and they just said to me, I said, have you done your self-risk assessment? I keep asking every one of them that, have you done your self-risk assessment? You need to put your self-risk assessment through to the trust so that they can know where to, put you or how to deal with your risk levels. And even when I initially was on isolation and they wanted to do they did risk assessment for me over the phone. I made them to understand my risk level, which was supposed to be medium, but they put it at low risk. So when I resumed back going to work, I went to download the self-risk assessment for myself. And I looked at it and I said, no, this is not low risk. I'm BAMA, although I'm not 55, but I have an underlying condition of high blood pressure. And so I'm in the medium risk, not the low risk. And I have someone in my household who is extremely vulnerable. So combining the two together, the risk assessments has to be high risk. The most disturbing thing is the way the Filipinos, the ethnic group, the Filipinos died. It was very disturbing because I looked at a lot of them. I don't know any personally, and I don't know any that died personally within my area. But in the union, I saw a few that came up and the photos and everything. It was very disturbing, and the one that pained me a lot was the pregnant African lady, that she was pregnant, although they were able to save the baby, but she died. And I felt, after all that we do, I don't know if anything was done by the government or any substantial thing was done for them, but losing their lives like that, if a lot of them were very young, they were very young, and it was very disturbing. And I could remember that during my own fight to be redeployed, I had to tell them, at the end of the day, I'm just a number. I'm just a number. Because if anything happens to me or happens to my family, it's not going to be so long before you take someone else to replace me and to continue the work. All you just do is give my family or give me flowers. And that's it. It's done. And that was what happened to these ones that died. It was very disturbing. It was. It was. Through all of this, it's just the passion. Once you're a nurse, you are just a nurse. You just want to keep at it, do your best for people, see that they are okay, where others have ended, you just want to continue. Although you will be more happier to have some rewards or whatever, but you just keep going and hoping that you will just continue to make a difference. You just continue to make a difference and add your own bits, your own quota to everything that is going on. And I think we are moving forward with the COVID. A lot has happened, but it's getting better, I believe. I would say racism have gone worse because it's always been there. But the pandemic brought the racism out more. It became a bit clearer to people. But it's always been there. It's always been there. Very deep and very enormous in all the workplaces. It's just that the pandemic sort of brought it out in the open to people who are not in the workplace and some other organizations. But I don't think the COVID made it worse or better, but it's just the same. It's been there for years. All of us heard about it. I've not been actively involved in any of the protest or rally or whatever, but in my own little way about Black Lives Matter, I responded to some of the chats and did joined some of the petitions and all those things online, but uh, about Black Lives Matter activism or rally or whatever, I don't particularly think any much has come out of it. And much it's just a thing of that period. To me, it's just a thing of that period. People raised it, people reacted to them, did everything, but it didn't stop it. It didn't really make any much difference in the way things are handled in discrimination or harassment for that period, I expected if it's having any impact at all, I expected people of color that are white to be more involved and step up, be, look inwards and step up to retrace their own way of dealing with people of color. But I don't think it was just a thing of that period. I believe it just, when a topic comes up, George Floyd, he died because a policeman was kneeling on his neck, and after a while gave up the ghost, and he says, I can't breathe, I can't breathe. We are being choked every now and then at the place of work. We are choked every minute. And in every way they can do it, you are choked, just like they did to George Floyd. But it didn't. It was just around that period. Now it's a year, I think, and the noise has gone down. Nothing much is coming from it anymore, and things goes back to the way they were, I think. I would like to see a lot of changes, but in particular towards people of color, of the minority group, ethnic group. I want to see them in high positions in the NHS. I want to see them in high positions in Department of Health and areas like that. I want to see people of minority ethnic group having to be in the hands of directors and decision makers of the NHS more than the way we have it at present. Also, I want to see a change in the NHS, the relationship between management and the minority ethnic group people, especially in the areas of disciplinary and things like that. They experience a lot as a result of that. A lot of them get dismissed based on the fact that when a panel is composed, when you put the panel down and they have to face the panel, you don't see anybody of color there. And definitely, what is determined already for that black nurse or Asian nurse. So we need to get past colors. We need to get past looking at people. Yeah, you have color, you are not a British, and you are not white, you are black, and you are yellow or whatever color. No. And we find that as the black, the ethnic group, minority group people, nurses especially, they work their hearts out with patients. They are very compassionate, they are very passionate with whatever they do, they are very proficient in anything they do. And they do a lot of things, most of their work to book. They practice very efficiently. And so we need to appreciate them. In the NHS, they need to rate them higher. There's no reason why you should discriminate against anybody. Because if them, as the minority group, discriminates against the patients they care for, that this person is not my color, how would they feel? But you get it even from patients who don't want them you to tarnish their skin with your color, because it's going to, your black color is going to stick to their white skin. But you just, sometimes you laugh over it. But we need to get past level. We're in the 21st century, and there's nothing in you discriminating against one tribe, one race, one color. We need a different approach. The NHS especially needs a different approach. If the NHS was able to take care of the NHS and use only white nurses to care for people in this country, they won't come to my country. They won't go to the Asian countries. They won't go to Africa to employ us as nurses. And I know we're a chunk of number in the NHS. So why not treat them equally and very well for the work they do? My proudest moment was with a patient who actually said to the family, uh, this person, this nurse, is a family because of what I've done to when she was in the unit, and the way I care, and that's what I do for all my patients anyway. I didn't see a reason why I'll go out of the way to please one patient than the other. So and after looking after her, she said to her family that if not the difference in the color, nobody will know that you are not my family, because you are a very good nurse. She keeps saying to her children, this is a very good nurse. She knows what she's doing. She's very helpful. She's been this, she's been that to me. And I felt very happy, because when even your colleagues don't appreciate you, they don't appreciate what you've done and everything you do, especially when you go through a rough shift. And at the end of the day, they come back to you as if, what have you done? You've done nothing. But with her, she was so incredibly, very, very appreciative. I've never met a patient like that. And she kept saying it to the point I said, no, it's not. It's enough. It's and the family too were very, very appreciative. And in my studies, I'm really proud of myself. I didn't know I could do it, because I'm doing an MBA, something I've not done. There are some courses I don't have any clue about, something like accounting management, accounting and financing management. So, I was like, how do I go through this course? And when my results came out, I passed it. I passed it well, and I felt, no. I'm really proud of myself, because I did 8 courses, which are mostly, apart from leadership, it was very, very strange and different to me. But I've gone through the 8 courses and I've passed them. I'm in my dissertation now. And I know I'll be prouder when my results is out and I finally complete the master's. It was very challenging having to work full time and to do a master's degree. But I know I've done very well. And sometimes I do this to myself. Get a pat on the back. Thank you.